Hi, my name is Allegra Allergy. I am a student at the University of Southern Maine. I am going to be presenting a case study addressing seasonal allergies in a teenager. Our case study begins with a 14-year-old female, Kayla. She is a relatively new patient to our office. She has mild seasonal allergies. She plays soccer in the fall, likes to be outside most days. She is overall a healthy teenager. She has been taking Claritin for her allergies, but says the medication has not been working, has not been relieving her symptoms. She denies alcohol, denies marijuana, and illicit drug use. She has no known other allergies. She denies allergies to medicine. She has not had a previous surgery or hospitalization before. Her mother is a 40-year-old. She also has seasonal allergies. Her father is also 40. He has a history of hypertension. She has one younger sibling, a brother, and he is 10, and he has no known allergies or illnesses. Kayla has had symptoms for a month and a half now. The symptoms are worse when she's playing soccer or playing outside in general. She has been taking Claritin for a month, as mentioned before. However, she has had no relief of symptoms. She told me she does not want to use nasal spray as they are gross. She is currently experiencing a runny nose, which is clear, red, itchy eyes, an itchy throat, which is causing her to cough, and she is sneezing. Her vital signs were stable, no fever present. Her BMI is 18.6. Kayla is a healthy 14-year-old. Her neurological assessment was within normal limits. She denies a headache, denies ear pain, denies neck pain. There are no swollen lymph nodes. As mentioned before, she has a runny nose, she's sneezing, red itchy eyes, an itchy throat, she's coughing. Lungs are clear upon auscultation. She denies shortness of breath. As far as cardiovascular concerns, no murmurs were heard, no history of cardiac abnormalities. As far as GIGU, both were within normal limits, as well as musculoskeletal was in normal limits. Allergies cause inflammation of the nasal membranes, which then leads to an IgE-mediated response to the allergen. So we can specifically test total IgE antibodies. This is included in the CBC count. We can also test eosinophils and basophils, which are part of the white blood cell differential. Eosinophils, basophils, and total IgE would all be elevated in an allergy. These markers tell us that our patient is likely to have an allergy. It doesn't specifically say that your patient has an allergy to X or to Y. It just says they have an allergy, positive for an allergy. So we have to keep that in mind. With Kayla, she had elevated eosinophils, basophils, elevated IgE as well. We did not perform a skin allergy test as this needs to be conducted by an allergist. If the parents and if down the road it's warranted, we will certainly schedule this test if the medication that we are going to talk about later on does not relieve symptoms. CT scans and MRIs allow the practitioner to look at the patient's structural issues and/or upper airway malignancies. A diagnostic procedure called nasal cytology allows the practitioner to sample the nasal mucosa, in which, if the person had an allergy, eosinophils would be present in those secretions. As far as pharmaceutical considerations, we have tried Claritin with Kayla. However, she says her symptoms were not relieved at all. For this reason, I would recommend Allegra Allergy 12-hour. It is another second generation antihistamine. There are less side effects associated with it compared to Zyrtec. Zyrtec has a lot of drowsiness. Another item that we may recommend would be artificial tears. This would help decrease redness and to help wash the eye of irritants. Even though Kayla was very adamant that she did not want to do nasal spray, we would reinforce that it would help decrease inflammation and decrease her symptoms overall. But at the end of the day, we have to focus on what she is willing to do. She's a teenager, and we have to make sure we are giving her a medication that she'll remember to take, one, two, that she'll want to take, and ultimately our goal is to relieve her symptoms. So we want her to be on board with whatever we are giving her. Even though Flonase may be helpful, it's not something she is willing to do, so we have to keep that in the back of our minds. Allegra Allergy 12-hour is recommended in patients 12 years and older. Our patient Kayla is 14, so it's appropriate. 5% of the total dose is actually metabolized. There's minimal metabolism in the GI tract and liver. As far as excretion, it's mostly excreted in the stool, 11% in the urine. The half-life is approximately 14 hours. The mechanism of action is that it selectively antagonizes peripheral histamine H1 receptors. There are H1 receptors and H2 receptors. H1 receptors are in the endothelial cells, whereas H2 receptors are in the GI tract, specifically in the stomach. So we have to know the pathophysiology as well as the pharmacology in order to be able to relieve our patient's symptoms. So we are targeting the H1 receptors. As said before, the Allegra Allergy 12-hour has less side effects than Zyrtec, and for this reason, that's why it was chosen. A serious reaction would be an allergic reaction to this medication, so it's important to educate our patient as far as what that would look like. We wouldn't want the parents to wait around, and we would like them to call us, and if it's severe, then obviously to go to the emergency room. Some of the common reactions include a headache, upset stomach, a fever, a cough, pain, diarrhea, dizziness, and upper respiratory infection can occur with this medication. Some drug-food interactions include grapefruit. So most fruit juices should be avoided. There may be grapefruit juice in the juices, so it's just, in general, probably shouldn't take this medication with any juice, but specifically grapefruit juice. As far as drug-drug interactions, Tums, Maalox, Mylanta, Phillips chewables, milk of mag, Pepcid, Rolaids, any substance with calcium carbonate, also aluminum, things of that nature are going to decrease the efficacy of Allegra Allergy 12-hour. Erythromycin may increase Allegra Allergy 12-hour levels, so we also want to be cognizant of that. So patient and family teaching is going to be especially important in this family. We want to teach them to avoid the allergens. So during this time, ragweed is usually the cause of seasonal allergies. Foods that we want to warn them of are bananas, cucumbers, melons, zucchini, sunflower seeds. We also want to let them know that fallen leaves may have mold in there, and then that can trigger her allergies as well. So if the family dog is out rolling in the leaves, which most likely they are, he could bring in the mold and other allergens. So we want to make sure that we're wiping off the dog and things of that nature. We also want to make sure Kayla is washing her hair, washing her hands, and also frequently washing her linen on her bed in order to decrease the amount of allergens. Another teaching point would be an air purifier. This may be helpful to decrease the allergens within the home. We would educate them to keep the windows closed, as allergens can come through the windows and trigger the allergies that way. We also want to educate Kayla to spend a limited amount of time outside mid-morning and in the evening, as that can be when the pollen is the highest. We can also have Kayla keep a diary of when her symptoms seem worse and when they seem to be relieved, and then she can modify her behavior based on what her journal says. So our ultimate goal of therapy here is to relieve symptoms and make Kayla more comfortable. We definitely want to let her know to avoid grapefruit and juices with grapefruit. We will have Kayla come back in 6 weeks to make sure the Allegra is managing her symptoms. As said before, if there is any allergic reaction, non-emergent, to give the office a call. If it's emergent, then she will definitely want to go to the emergency department. If the patient visits again and has no relief of symptoms, we will go through other diagnostic testing in order to determine more specifically what is happening with Kayla. As far as dosing of Allegra Allergy 12-hour, we'll have one tab, which is 60 milligrams, orally every 12 hours as needed, so a maximum of 2 tabs in 24 hours. It's recommended not to exceed 180 milligrams per day. Allegra Allergy 12-hour is available over the counter, and so we want to make sure that Kayla and her family know exactly what this looks like and go from there. It is important to mention to Kayla and her parents that I would like them to go to the pharmacy together. I'm sure if Kayla went by herself, she could talk to the pharmacist. However, I am not sure if she would feel comfortable talking with a pharmacist or if she would enlist a pharmacist to help her. So, just as precautionary measure, if the parents and her go together, then more likely they will be able to pick the correct medication. I have shown them what the medication looks like in order to decrease the likelihood of choosing the wrong allergy medication. And this completes the case study. Thank you very much for listening.